So when you're doing blood pressure, you want to grab your stethoscope and make sure that the stethoscope is open. The bell will show, you want to use the larger side of the bell when using it for adult patients, and the green dot will be facing toward the larger bell. So when doing blood pressure, you're going to first make sure your patient sits upright and make sure their legs are uncrossed. You're going to grab the proper cuff size. We do have the medium size cuffs for that you will get in your kits, and we do also have larger cuffs for those who need it. Make sure no clothing is between the patient's arm and the cuff. You're going to palpate the brachial artery and then align the cuff demarcations with the brachial artery. There's an arrow that points toward the artery. Position the bottom edge of the cuff 1 inch above the antecubital space. Apply the cuff evenly and snugly. Make sure your gauge is also directly in your line of vision. Extend the patient's arm and palpate the radial pulse. Make sure to use your fingers and not your thumb to palpate. You will go ahead and inflate the cuff until you can no longer feel the radial pulse. Deflate the cuff. Record the palpatory systolic reading. You're going to wait at least 30 seconds. Extend the patient's arm again, and then place the bell of the stethoscope over the artery just below the cuff. Make sure the bell does not come in contact with the clothing or the cuff. Inflate the cuff rapidly, 30 millimeters of mercury above the systolic pressure that you recorded earlier. Make sure that you can also hear the pulse sounds as you're inflating the cuff. Slowly deflate the cuff at a rate of 2 millimeters of mercury per second. When you first start hearing the pulse sounds, that will be your systolic reading. When the pulse sounds disappear, that will be your diastolic reading. You're going to deflate the cuff until all sounds stop. Record the systolic and diastolic blood pressure in Dentrix in the patient's chart. When you're finished taking the patient's blood pressure, you're going to clean the earpiece with disinfectant using our Cavi wipes.